Good afternoon. We're here at the 68th AHCA NCAL annual convention with Don Pelligrino from New Jersey. He's CEO and co-owner of Bridgeway Healthcare in New Jersey.
Yes.
Welcome, Don.
Thank you.
Thank you. We're very excited to have you and hear some insight, and particularly we want to know what's keeping you up at night with all the changes happening.
Well, obviously with so many changes hitting our industry at one time, the big issue that we're having obviously is the implementation of the rules of participation. That's a big challenge for our staff right now. A lot of our staff is concerned about the time that's necessary to be on top of all these changes, the volume of paperwork and rules that we have to conform with, while still servicing the residents that we're required to take care of and doing it very well. The other issue is getting to know your data. Now we're a healthcare provider, but data is gigantic. The more that you know your data, the better that you're able to interact with accountable care organizations, your hospital systems, the insurance companies. So you really have to be on top of that. The other big thing, being from New Jersey, is they've implemented managed long-term care support services, managed Medicaid, and though it was a good intention, not much went into determining the rate setting in the future, where they didn't work off cost reports any longer, and we've been working off of an old rate that they've been slowly adding some CPI adjustments to. But as an operator, we're very nervous until they can finalize the rate setting methodology. How is it going forward, and how do we plan accordingly?
And with that, in New Jersey, New Jersey is one of the case mix states. Some people don't know what that means.
Right.
Their MDS derives a RUG level, and I heard recently that you were transitioning, so you were not a case mix state, or you were, or vice versa.
We were, but now with MLTSS on Medicaid, right now we're just getting a flat rate. It's working off of an older rate that we've had with minor changes. The problem is they're not taking data in to determine, as a cost-based system and adjusting your reimbursement accordingly. They're not taking that into account. So they really need to, any states that come in to take into manage Medicaid, they need to really set how are they going to be dealing with rates in the future. Is it going to be a cost-based with reporting? Everything's based on data, but it should be doing that to make sure that we're reimbursed properly, especially with the challenges in New Jersey where they're looking at, minimum wage over time stepping up. So there needs to be a methodology to adjust the rates to make sure that we can meet all these changes for, minimum wage as well as the, rules of participation and the like.
Thank you so much. What about immigration or things of staffing? And you mentioned minimum wage, so...
Well, a lot of it with the current administration, some of the good things, and hopefully they do follow through, is where every new regulation that they come up with, that they, especially in our industry, which I feel they've kind of gone overboard in regulations. There's a lot of regulations that may be duplicate. And so if we could lose 2 regulations for adopting every new one and doing it intelligently. But the other big challenge is, as an independent operator, is immigration. No matter how great your outcomes are, if you can't get quality staff that's coming in, and my partner, their family has been with us in the business for 37 years, and trying to deal with the different communities that we work for a long time, immigration was very key to our success. But we need immigration reform, and we need it soon, because all of our operators in our communities are struggling to either retain staff, and no matter how good your outcomes are, if you don't have enough quality staff that's providing it, it's going to be a challenge. So I really think that one of the biggest issues that we need to, and I know it's a kind of a hot topic subject, but we definitely need some type of immigration reform.
And I'm from Massachusetts, and I hear that they're putting on the ballot this year, they're going to up the minimum wage to $15 an hour. Is that something that...
In New Jersey, they're currently going to be electing a governor shortly. And some of the stands is that they definitely do need, right now, where the minimum wage is set is too low for someone in the cost of living in New Jersey. It does need to be stepped up, but they're talking about doing it over time. So hopefully we'll be able to adjust and react to it. But obviously we have to help set, in Medicaid reimbursement and the like, to make sure that we're getting the proper reimbursement so that we can pay these people a good wage, as well as meeting all the other challenges to the regulations that we're having.
And that staffing then leads into the 5-star, because the 5-star has the 3 components: the health inspection and the staffing and the survey. I mean, and the quality measures. So how does that even play into this?
Well, I'm glad that you asked that because the 5-star is something that does keep me up at night. Both of our buildings are 5-star rated.
Congratulations.
But
it's amazing.
you never know where in the future a survey could go. You know, a lot of times there's something that could be a minor issue, and it could lead to a deficiency, or depending on the surveyor how that they view that deficiency. In New Jersey, I've been trying to work with our state officials. I'm on the Healthcare Association of New Jersey committees, and looking at having some type of reform through the survey process for the independent review. So at least now that we can have a true independent review, because right now as we appeal our deficiency that may have been found, there needs to be a little more dialogue to come back, because it does impact our star rating, which again can affect our standing in our ACO, since it's 3 stars or minimum. So hopefully that it can be reviewed and more people having input if in fact that a deficiency does come out, and that it gets weighted accordingly.
5-star, congratulations. One more quick question. The survey process and you'd mentioned that, of course, if one appeals it, then it delays the certification, but the new proposal to have this, take QIS, merge it with a new way, to have the integrated reliability of the survey, I hear that. What about the civil monetary penalties specific to New Jersey? Has it gone up? Has it gone down? I know where it is nationally. I'm curious to see in New Jersey.
Tom Coble has done a great job with the civil monetary penalties. New Jersey has really not been impacted too harshly with the civil monetary penalties. They're out there, but we're not like other parts of the country that have been impacted to a greater degree. I think that the inroads and Tom, as being the chair of AHCA and focusing on that, did a fantastic job. CMS has gone back, looked at it, and they're re-looking at the scope and severity and how it should be, rated out. So like anything else, with all the changes for the rules of participation, the civil monetary penalties, even the new RCS scoring systems, they're going to need to evolve over time. And as long as everybody looks at these are imperfect systems, and that they're going to talk to the providers, because we have, again, it's in our blood. We've been doing it for 37 years. And the people that are in our business are special. And we have to take care of, many times through the regulation, they want to do the right thing, but sometimes they overreach and it actually becomes counterproductive. And until they can get the immigration and all these things together, the biggest complaint I get from my staff is we're overwhelmed with all this regulation. And I don't know if I I want to care for patients and not worry about all these other issues now that we have to deal with. So I believe we're on the right path. Mark Parkinson and everybody is providing great leadership, and I really believe that there is a great outlook for our industry.
That's great. Well, we are grateful for your time, grateful for everything. Don Pelligrino from New Jersey, thank you so much.
Thank you.
Look
Pleasure
forward
meeting
to
you.
seeing you. Thank you.
Thank you.